morning everyone, a very warm welcome to you all. My name is Geeta Khanwani. I am from the Department of Psychology, Manipal University, Jaipur. Today the topic of my presentation is Impact of Social Distancing on Psychological Well-being during the COVID-19 pandemic. As we all know, COVID-19 outbreaks turns the human life upside down. WHO 2020 announced severe acute respiratory syndrome as global pandemic and published guidelines to effectively curb the spread of COVID-19. However, the adoption of term social distancing for maintaining adequate physical distance leads to misinterpretation among the population. People started believe that they have to cut all their social connections and completely isolates them from the others in order to safeguard themselves from the pandemic. Several studies also reported that social distancing disrupted the fundamental human need, that is socialization, that has a major impact on the psychological well-being of the population. According to Diner 1997, psychological well-being is defined as the one's satisfaction with life based on the cognitive and emotional aspects. Most studies reported that social distancing built social fear or anxiety as individuals not only maintain physical distance, that is 6 feet, but also get skeptical and distrustful about the others in the community as they perceived them as the potential carriers of coronavirus. Increased concerns about the psychological well-being of the population driven the attention of policymakers. Because of that, on March 2020, WHO replaced the term social distancing with physical distancing, which means maintain physical distance from one another but stay socially connected. Several studies also reported the impact of COVID-19 pandemic on mental health, like Panchal and colleague 2020 in their study reported that there was an increased rate of anxiety or fear, depression, substance abuse, domestic violence or child abuse, suicide, loneliness or social isolation, and many other common mental health issues among the population. To support the study, several studies on mental health implication due to COVID-19 pandemic was conducted. An online survey study was done on general population of China with sample size 1210 by Wang and colleagues 2020. The aim of the study was to analyze the impact of COVID-19 on mental health issues like depression, anxiety and stress. Findings suggested that the approximately 16.5% of population suffered from depressive symptoms, 28.8% was suffered from anxiety symptoms, and 8.1% was suffered from stress conditions. Similar to that, another study was done by Zenko and colleagues 2020. It was a cross-sectional and self-rated survey which was conducted on individuals in a self-isolation state for 14 days. The sample size was 170. It was done in China. The findings of the study states that anxiety positively associated with the stress and negatively associated with the sleep quality and social capital. Sleep quality and was positively associated with the social capital. Another online survey was conducted on the general population of China with the total sample of 7,145. The aim of the study was to assess the impact of social distancing on the sense of alienation feeling among the population with the symptoms of PTSD, anxiety and depressive symptoms. The findings of the study supported the hypothesis that is social distancing develops the sense of alienation feeling which leads to PTSD, depressive symptoms and anxiety symptoms among the population. Ways to maintain better psychological well-being during COVID-19. To increase the psychological well-being of the population, there were certain ways given to the published by the WHO. Social connect via social media, adopt healthy lifestyle, minimize newsfeed, engage in family activities and hobbies, extend helping hands for others, take help via telecounseling. Future direction. More Indian studies based on the psychological well-being of the population during COVID-19, comparison studies on the impact of social distancing and physical distancing on psychological well-being, comparison study on the psychological well-being during the lockdown and post-lockdown period, impact on psychological well-being among different age groups during COVID-19 pandemic, positive changes adopted by the human population during pandemic period. Last but not the least, social distancing doesn't mean social isolation. Stay socially connected. Thank